Thank you very much. The next presenter is Dr Malleswari. She's going to present on tackling of choroidals because of ectopic uveal tissue.
Good evening. Thank you one and all for giving me this opportunity. So choroidals is a nightmare for every glaucoma surgeon. So I am going to present a rare case of choroidals with ectopic uveal tissue. This 50-year-old male came to us in Jan 2022. PA was done outside 2 weeks back. Baseline pressures for right eye 40 and left eye 58. And with 4 medications, 4 AGM, left eye pressure 32 and right eye 22. So one of our consultant added bemtoprost in left eye. And after 3 weeks, again the pressure in left eye was 22 with 0.8 cupping and superior NRR loss. But the thing is, he developed acute allergy for the anti-glaucoma medication. So TRAP was planned and done on 7/2/2023. Surgery was uneventful. 10 days post-op period, the pressure was 22 in left eye, and after massage it is coming down to 10. After 3 weeks, again the pressure was 30 with massage 8, and so argon laser suture lysis was done. After suture lysis, the pressure was 12. So after 2 weeks of argon laser suture lysis, suddenly the patient presented with some decrease of vision in left eye. So AC was shallow and the vision was 612 and IOP 6 millimeters of mercury. So they tried various combinations of oral and systemic steroids for 6 weeks, and as there was no improvement in choroidals, so this patient is referred to me at this point of time. So I thought already 6 weeks they tried some other medications and all. So I thought wound exploration and flap repair is the best thing to do for this patient. So I went inside and this is the video. So this is the preoperative. So those are the choroidals and B-scan. And so when I tried to open the bleb area, the total conjunctiva was scarred. So I tried to open the conjunctiva without having any buttonhole. Surprisingly, I found a small tenon cyst over here and some brownish pigmentation ring kind of thing inside. So I tried to release the adhesions on surrounding this area, this arrow area, and those adhesions removed. And when I opened the tenon cyst, I found a brownish pigmented tissue in that one. So that was the ectopic uveal tissue. So that is causing scarring and tenting up of the scleral flap, which is causing leaky trap, and it's not leaking outside, but it is causing tenting up of the scleral flap and choroidals. So I tried to open, is there any necrosis or any other thing? Nothing was there. So I tried to form the AC with the visco, and I want to find out whether any other ectopic tissue is there or not. So at other point of here also there is some ectopic tissue away from the bleb also. So here also some ectopic tissue is there. So I try to suture the scleral flap. So nearly 9 sutures I kept to the scleral flap. So wherever leak is there, I try to seal that off. And again tamponade is applied with the help of scleral patch graft. So two anchoring sutures were applied onto the scleral patch graft, and then conjunctiva is closed. Finally, the bleb is formed nicely. So I try to close the conjunctiva with the help of vicryl sutures. So bleb is raised nicely and AC formed tightly. So at 1 day post-operative period, AC became deep and the choroidals were 90% dissolved, and these are the preoperative B-scan choroidals, and this is first day, and the second picture is the 1 week post-operatively. So this is the HFA of the patient post-operatively at 1 month, and the day 1 itself choroidals were resolved and the vision is regained back to 6/9. Until now, the patient is maintaining vision as well as he is not using any AGM. As I searched for the literature, there is nothing mentioned in the literature where the choroidal tissue causing the tenting up of the scleral flap. So that I found it's a rare situation. That's why I just want to present this case. Thank you for giving me this opportunity.
Madam, was this not a deep flap taken, means the incision which was taken? This was done by somewhere else, this was done?
No, so in my hospital only, some other surgeon done that.
So don't you feel that this flap that went deeper and because of that?
No, it's
okay.
flap was very much nice. It was the ring of ectopic tissue which was present there. It is really causing that pull over the scleral flap. So I just removed that area and I kept nearly 3 sutures in that area so that it became flat, and I gave tamponade with the help of scleral flap. That
query once in the primary surgery, one of the flap was not seen at that point of time.
Sir?
At the time of the primary
surgery. I am not the primary surgeon, so I don't know whether that's why if any vascular tissue is there.
If it would have been ectopic, then it would have been present at the primary surgery also.
Yes, sir. Maybe that's what, sir. Even if
it was a referred case.
It was done in my hospital only, but I was not the primary surgeon.
No, in your hospital, but not the referred case.
Not referred.
But then you could have asked the primary
Yes, sir, but they were maybe after 6 weeks or 1 month they couldn't remember the case properly, sir. But other place also some ectopic tissue was there, so I thought this must be the. So I searched some other areas also. Little bit of ectopic tissue was there, but I couldn't keep it in that video because it was out focused while taking the video.
What's your opinion about
Very unusual case. I have not faced it.
Yes, ma'am. In literature also nothing was found.